So this is the Van Herrick grading. Van Herrick grading essentially is very useful to identify the depth of the anterior chamber in patients in whom it is not possible to perform a gonioscopy immediately. You can use a Van Herrick for a screening to identify if the angles are open, likely to be open or closed. So as you can see in this picture, you have one slit on the cornea and this slit is on the iris. So this slit is on the iris. You can see this gap here. This is the anterior chamber. By definition, Van Herrick is a technique where we make two slit beams, one on the cornea and one on the iris at the very periphery. So this is the periphery of the iris, and you can see that there is no space between the two, which means that the Van Herrick grading is closer to 1. So when you say grade 1 of Van Herrick closing, it usually means that the anterior chamber depth is less than 1/4 of the corneal thickness. So this is very important for us to identify as an outpatient procedure itself, because once we suspect that the patient has a grade 1 or a grade 2 based on Van Herrick classification, we know that it is likely that even on gonioscopy the angles may be narrow. Whereas if you see a patient with grade 4, that is the anterior chamber depth is equal to or greater than corneal thickness, we can be comfortable and we know that the gonioscopy is going to show us an open angle. So what are the aggravating factors for angle closure? Basically, it is mydriasis. Anything that causes the pupil to dilate can be an aggravating factor for angle closure glaucoma. So what are the conditions in which pupil can dilate? Of course, the most common is drugs. Any drugs that we may use, such as mydriatics. And as mydriatics, the primary action is to dilate the pupil. Example of mydriatics can be those which are combined with cycloplegia, such as atropine or homatropine, or even plain dilatation, such as phenylephrine, or patients who on whom we are using tropicamide. All these can cause, or cyclopentolate, all these can cause mydriatics, mydriasis. And apart from this, it can also occur as a side effect of certain medications such as antipsychotic medications, anticonvulsants, antidepressants, anti-Parkinsonism agents, and sympathomimetic agents. So whenever we advise medications for certain systemic diseases, if the side effects are monitored, we might be able to identify why the patient has a glaucoma along with systemic medications for certain diseases. We also have to be aware that physiological conditions, such as in a dark room. In a dark room, we are aware that in a dark room, the pupil will dilate, and in bright light, the pupil constricts. So in the dark, when the pupil dilates or when the pupil undergoes mydriasis, there is a possibility that there can be crowding in the angle. Now, in a normal eye, it wouldn't matter so much, but if the angle is already narrow, there can, when pupil dilates, there can be peripheral bunching of the iris, and that can result in an angle closure glaucoma. And emotional stress, it again, because of the sympathetic action, it can cause mydriatic pupil. All of us know that when we are in shock, the pupil will dilate. So even anxiety, the pupil is known to dilate. So all these things can result in, or rather aggravate. It cannot result in angle closure, but it can aggravate an already narrow angle to become glaucomatic.